patient is it okay if okay, patient skin is warm, dry, and intact. No noted cyanosis. I will now do your hair. I will put on gloves, and then I will inspect the hair. Patient has no pediculosis. Patient hair is one color. Strength is strong. Head is round. No noted open wounds, no noted bleeding. Patient hair and head is healthy. I will now do your nails. Is it okay if I see your hands? Okay. Can I see both of them, please? Okay, I will now do the capillary refill. Patient's capillary refill is less than 3 seconds. No noted abnormalities in the hand. I will now test for the skin trigger. No noted 10, patient is hydrated. No noted cyanosis, nail is translucent. I will now check for pitting edema. Okay, can I see your legs, please? No noted pitting edema in both legs at a 0. No noted ecchymosis. I will now do your pulses. Okay, and grade your pulses. Temporal, +2. Carotid, +2. +2. Can I see your left arm, please? Brachial, +2. Thank you. Sorry. You're okay. Radial is +2. Ulnar, +2. Is it okay if I go near your pelvic area?
Yeah.
For your femoral pulses, +2. For your popliteal, +2. For your posterior tibial, +2. And can I see your foot, please?
Sorry.
No, you're okay. Let me take that off. For your dorsalis PD, +2. Thank you. I'm gonna do the head, neck, and face. So head is normal cephalic, it is round, it is symmetric with eyes, eyebrows, nose, and mouth. Shoulders are approximated to head, and no noted abnormalities. And then now I will do the neck. Can you, no noted goiter, no noted enlargement, no tracheal deviation, trachea is midline. Can you please mimic my movements? Go to the side, the other side, go back, and go front. No noted crepitus, no noted abnormalities. I will now, also for your nails, can I see them one more time? Can you please go like this? Okay, for the window test, normal results, no noted clubbing. Patient's nails 160 degrees. I will now do the face. I will provide hand hygiene, hand wash. Is it okay if I see your sinuses on your face? Okay. I'll do frontal, maxillary, and ethmoid. Anything? No noted inflammation, no noted abnormalities. And then now I will test for your cranial nerves. Okay, for your nose, cranial nerve number 1, it is midline. No noted abnormalities, lesions, or polyps. I will now see if you have any fractures or deviated septum. Can you please look up for me? No noted deviated septum, no noted fracture, no noted drainage, swelling, or redness. Seems normal, okay? And now I'm going to see your eyes, okay? Look at me, please. Patient corneal light reflex is intact. I do see a twinkle and the red normal result. Can you please follow my pen line? Okay, thank you. Almost done. Okay, no noted nystagmus, and then 2 more tests, okay? So please look at my pen line. Convergence test is normal, and then please look at a object behind me. And then please look at me. Okay. And then please look at my pen line. Okay, convergence and accommodate test is normal, no noted abnormalities. I will now Pupils are equal, round, reactive to light accommodation. The iris is brown, the sclera is white, and I will now put on gloves. Can I see your conjunctiva, please? Okay, can you please look up? Conjunctiva is pink. Can you please look down, ma'am? Okay, thank you.
Sorry. It's okay. It's off.
Okay. Okay, good. Sharp. Sharp. Soft. And one more. Sharp. Okay. Thank you. You can now open your eyes now. Okay. Can you please open and close your mouth? Okay. TMJ is negative. No noted cracking or popping in the jaw, which is good. I will now, can you do number for facial? Can you please mimic my facial expressions? Can you raise your eyebrows? Can you smile? And then puff out your cheeks? Okay, no noted CVA, no noted Bell's palsy. I will now do number 8, which is acoustic. I will now palpate your ears, is that fine? Okay. You feel any pain? Okay, I will now inspect your ears. Okay, let me see your left ear. No noted swelling, no noted drainage, no noted redness, which is normal. Okay, I will now see your right. No noted redness, swelling, or drainage. Okay. I will now inspect bilateral earrings. Everything seems good for your ears. I will now do 2 tests on you, okay? I'm gonna do a whisper test and a round breath test. I will cover my right and cover your left. Go to my right, cover your left, and tell me what you hear, okay?
I love you now.
Okay, I will now do the other side.
I love you too.
Okay, thank you. And then I'm gonna ask you to stand really fast for the round breath test. I will ask you to close your eyes and stand straight for me.
Okay.
Okay. No noted swaying. Round breath test is normal. Can you please sit on my head? Thank you. No noted redness from your drainage. Everything seems fine. I will now do the accessory first. I'm gonna put pressure on your shoulders. Can you please shrug for me? Okay, cranial nerve number 11 is intact. I will now do number 10, which is 9, 10, and 12, which is your mouth. I will now be testing your gap reflex and your speech. Can you repeat your name and your date of birth for me, please?
March 11, 2001, Miley Sando. Sorry.
Okay. And then I'll test your gag reflex. Can you please open for me? Okay. The gag reflex is normal. Patient speech is coherent. And then one more time, can you say off for me? Patient has rise of the uvula, which is good, normal. And then now I'll inspect your mouth. Can you please open your mouth, please? Thank you. Patient has 32 teeth noted, normal. Stensons, normal. Can you please raise your tongue for me? And like, thank you. Like right here, as I can see your, there you go. Mordens is normal. And then can you mimic, lips are moist, no noted dryness or no noted halitosis, no noted bad breath, okay? Can you please mimic for the tongue? Go and high, and side, and down, okay? Thank you. And now I will do your trachea. Okay. Can you please look up for me, please? No noted goiter. Patient's trachea is midline. I will now hear for a breathing in your throat. And I will be using the bell. Okay. Okay. Okay, no noted breathe. Noted. I will, and then the lymph nodes. Okay, so preauricular, postauricular, tonsillar, submandibular, submental, precervical chain, postcervical chain, occipital, and supraclavicular. Any pain?
No.
Okay. No noted goiter. Everything seems normal. And now I will be doing the respiratory. For respiratory, no noted nasal flaring, no noted cyanosis. Patient is calm, hands are on lap. No noted confusion, no noted use of accessory muscles. No noted tripod positioning, no noted labor breathing, shortness of breath, which is normal, it's good. Okay, I'll be now hearing for your lung sound, okay? Okay, can you take a deep breath for me, please? Okay, this side. Can you take a deep breath? Okay, deep breath. And other side. Okay. Okay, is it okay if I, okay. Breathe in for me. And take a deep breath for me. Okay, we're now doing your back. Chest expansion is 1 to 2. Take a deep breath. Thank you. Take a deep breath. Take a deep breath. Take a deep breath. Okay, take a deep breath for me. And then the other side. Take a breath. Thank you. No noted adventitious sound, no noted stridor, wheezing or crackles, which is good. Now I will be testing for chest expansion. Can you take a shot? Thank you. Okay, I'll raise this real quick. Can you take a deep breath in? And then out. In. And out. Okay, thank you. Chest expansion is 1 to 2, no noted abnormalities. I will now be doing your cardiovascular. And now I'm inspecting no noted external line incision for cabbage. Okay, and then I will be doing auscultating for your heart sounds. Thank you. Aortic, second intercostal muscle, right midclavicular. Aortic is S1 greater than S2. Pulmonic, left midclavicular, second intercostal space, S2 is greater than S1. And then herbs, S1 is equal to S2, third intercostal space, left midclavicular. And then I'm gonna go down, okay? For tricuspid, S1 is greater than S2, left midclavicular, third. Fourth intercostal space. And then can you please raise your breast for me, please? MacBuckle, which is the mitral, which is a PMI. S2 and S1 are present. Okay, that was the left midclavicular, fifth intercostal space, known as murmurs.
And what I'm going to do is measure it, and then I'm going to push a little bit too to see that range of motion.
Oh.
Okay. And now what I need you to do is turn it the other way, like this, sorry. And push. Okay, now what I need you to do is lay your hand flat on the table, and whenever I say go, you're gonna turn your wrist towards your pinky like that, okay? So you can go ahead and do that. Okay, now straighten it back up, all right, and do it the other way towards your thumb. Okay, good. So now what we're gonna do is measure the fingers. So I need you to put your elbow on the table and make a fist.
The left?
Like that, yeah, just like that. So with your fingers flat, yeah. Okay, so let's turn it towards me so I can get to it. Okay, so I'm gonna do the same thing. I'm gonna measure it, and then I'm gonna push down a little bit too. Okay. Tell me if it hurts. Okay, good. Okay, so now we're gonna put your elbow on the table again, like how you were, but with your fist more open and your fingers bent like this, like a claw.
Okay.
Yeah. So I'm gonna do the same thing. I'm gonna push a little bit after I measure the angle. Okay. And keep it like that, sorry. Okay, now I'm gonna do the other side. Okay. And what I'm gonna do is put this right in this crease, and what I need you to do is pull your finger up towards the ruler and then go down as far as you can with it. Okay, so we're gonna start with the pinky. Okay. Okay, good. This one. Okay. Make sure you're keeping your hand flat. Okay. And last one. Okay, good. We're gonna look at your thumb now. So what I need you to do is put your side of your hand on the table like this, and then with your thumb out like this, making kind of an L. Good. And now what I need you to do is lay it flat and put your thumb out as far as you can, kind of making an L with it too. Good. Okay, so now what I need you to do is put your elbow on the table and then bend your thumb right here and right here, just like this.
Like this?
Yeah. Push. All right. Good. So now what I need you to do is try and touch the tip of your fingers together with your thumb for each finger like this. Okay. Now we're going to test the muscles in your hand. So what I need you to do first is lay the back of your hand down like this, and then bend your wrist a little bit towards your pinky, going, it's kind of hard to do, yeah. But what I'm gonna do is pull on your hand and just don't let me move you, okay? Okay, so we're gonna go now. Good. Now do it towards your thumb. Okay, I'm gonna pull and don't let me move you. Good. Okay, so now I need you to put your palm down on the table like this, and then lift your wrist up. Okay, and I'm gonna pull it down, don't let me move you. Okay, now put the side of your arm down like this, and turn your wrist backwards, exactly. And I'm gonna pull. Okay, and then now lean in and tuck your elbow in. And I'm going to do the same thing. So put your wrist backwards like this. Okay. All right. So now you can sit straight again and turn your hand the opposite way. I'm going to pull this way. Good. Now lean in and tuck your elbow in.
But pushing the same way?
Yeah, pushing the same way. Okay. So now what I need you to do is lay the back of your hand on the table and just try to bend right here. Bend your fingers up like this, and then I'm going to try and move you, but don't let me move you. Okay, so we're going to do one finger at a time. So first I need you to do the pinky. Okay, and I'm going to push. Okay. These two are kind of hard. So then we'll do this one. Okay, and don't let me move you. Okay, middle finger. Okay, and then others. Good. Now I'm gonna hold this down so you can try and bend the tips of your fingers, and then I'm gonna try and pull on them. Okay, so pinky first. Okay, my ring finger. My middle finger. And now index finger. Okay. Okay, so what I need you to do now is put the back of your hand down on the table and then lift just this part of your finger up. Yeah, straight up like that. And I'm gonna pull on each one, okay? And don't let me move you. Okay. Good. And now what I need you to do is make kind of like a claw with your hand, like this, and then lay your arm flat on the table. And I'm gonna try and push on these fingers, and don't let me move you. Okay. And you can keep your wrist down like that, but now make like a longhorn sign. Okay, I'm gonna push on these two fingers. Okay, and you can lay your palm down now. And I'm gonna try to push these fingers in towards the middle, and then try not to let me move you, okay? All right, so we're gonna start now. Good. Good. I'm gonna do this one both ways. Okay. And now what I need you to do is put your elbow on the table, and I'm gonna try and push your fingers, or pull your fingers outward, and you have to try and keep them close like this.
Oh.
Okay. These fingers are usually not as strong. This one another way. Okay, okay. Okay, now you can lay your, the back of your hand flat on the table and lift your pinky up, and I'm gonna try and move it.
Just the pinky?
Yeah, just the pinky. Okay. All right, now lay your hand flat and pull your pinky outward, and I'm gonna try and push it up. Okay. Now you can put the back of your hand back on the table and then try and touch your pinky and your thumb together. And I'm going to try and pull each of them apart. Okay. So now with your elbow on the table, if you could do this and then keep your thumb outward. Or sorry, keep it inward, touching your hand, yeah, and I'm going to try and pull it. Good. Now you can lay your palm flat on the table and keep it outward, and I'm going to try and push it in. Good. Now with the back of your hand on the table, if you do kind of like a thumbs up like this, and I'm going to try and pull it this way. Good. Okay, and last few things we're gonna do. Last few things we're gonna do is I'm gonna have you put the side of your arm down on the table like this, and then put your thumb outward, kind of like you're making a U, and then bend at both joints. Yes, exactly. What I'm gonna do is try and pull up on both joints. So first, we're gonna do here, and then here. Good. Now I need you to straighten your thumb like a thumbs up. Yeah, just like that. I'm gonna pull on it. Okay, I'm gonna take your carotid pulse on both sides of your neck. Perfect. So she's +2 on both sides bilaterally. So I'm going to look at your trachea. It's in line with the rest of her face. It's centered. There's no bumps or anything like that. It's perfectly symmetrical. Okay, so next I'm going to move on to your arms and hands. I'm going to look at your arms first. So I don't see any lesions or anything like that. There's no drainage. I'm going to check to see her skin turgor. Okay, it bounces right back. Perfect. Can you point your hands down for me and point them up and give me a twirl and the other way? Awesome. And can you wiggle your fingers for me? Perfect. All right, so you're gonna push against my hands and then pull. Good. I'm gonna check for capillary refill in all of her fingers. Okay, capillary refill is good. It's filling within 1 to 2 seconds. So next I'm gonna listen to your lung sounds and then I'm gonna listen to your heart sounds. So there'll be 6 on the front, 1 on each side, and 6 in the back.
Got it.
Okay, so lean back for me. Okay. Breathe in. Breathe out. 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 Breathe in. And breathe out. Okay, now I'm going to check on either side, so if you could lift up your arm for me. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Perfect. And if you could turn for me so I can check your back. Okay. Breathe in. Breathe out. Breathe in. And out. In. Out. In. Out. In. Out. In. Out. Okay, perfect. So her lung sounds good. I don't hear any crackles or wheezing or anything like that. It's all normal. So next I'm going to go in and listen to your heart sounds. First I'm going to listen to your aortic, then I'm going to listen to your pulmonic, then I'm going to listen to Erb's point, then I'm going to listen to your tricuspid, and then your mitral. Okay. So first I come in for your aortic. Sounds good. Your pulmonic. Very strong. Erb's point. Good. Your tricuspid. And your mitral. Perfect. So her heart sounds are normal, very strong. Up next I'm going to inspect your legs. So just looking at her legs down here, the patient would normally be in a gown, and so I would be able to inspect more, but just for the sake of the video, we're going to take a look down here. Do you shave?
Yes.
Okay. But I do see a little bit of hair growth, so that means there is good circulation down here. I'm going to take your pedal pulse in both of your feet. Okay, feels good. Okay, so just looking at her skin, there's no abnormalities. It's the same color as the skin all over her body. There's no discoloration or anything like that. So next I'm going to test your strength. Can you push against my hands and pull? All right, can you point your toes down and point them up and give me a twirl and the other way? Can you wiggle your toes for me? Perfect. Okay, so next I would lower the patient's bed down and have her side rails up. I would let her know where the call light is and let her know that the doctor will be in shortly, and if you need anything, you can go ahead